Okay, so what I'm just going to do is briefly outline how I plan to run this session. Those of you who can't speak, it's a shame, but do feel free to use the chat box and I will have a look at it from time to time. I'm intending to use some slides. It won't be death by PowerPoint, there's just a few. And the reason being that I just want to give you an overview of some of the issues that we cover when we run the short intensive course. And I'm very much interested to hear from you, your ideas and challenges that you're facing either in your work or in your parenting, if you're here primarily as a parent, because we get very much mixed groups of people on these sessions. So we've got this time where, as I said, I can give you a bit of an overview. Obviously, it's a huge topic, it's a huge subject. So I'm going to, as I said, give it a bit of structure and tell you how we approach it, and then spend a bit of time on each of the three categories that I'm going to divide the children and young people into, and say a bit about the work that we also do with families. Kim is asking me about a copy of the slides. No, I don't do the slides on the free webinars, but what you can do is ask Illuminations for their recording this session, so you can ask them for recording. So if you want to go over and have a look at any of the slides that I use, which, as I said, are just really tasters, then you're welcome to do that. But I don't actually get involved in sending out slides and so on the freebies. Okay, thanks. It's a question that probably somebody would have asked, so I'm glad you asked it now rather than later. Okay, so I'm going to just do a share screen, and I hope this will work okay. So just give me your patience for a moment while I click on. Okay, no, this one. Okay, that's the one I want to share. Right, so just let me know, can everybody see that slide okay?
Yes, thank you.
Yes.
Right,
thank you.
Okay,
Yes.
Great. Oops, it's popped itself back out of presenter view. Right, okay. So you've got me on screen, so you don't need a picture of me on the slides. The illustration I've used there is from a book called Happy Kids, Happy You, not surprisingly. It's by a lady called Sue Beaver, and she's someone who we've been associated with for some time. She works in the UK, and actually she trained as an NLP trainer, a trainer in neurolinguistic programming. She was particularly interested in the applications of using NLP with kids and with young people and families. And she ended up becoming quite an expert. She was training for local education authorities and local authorities and schools and so on. And she wrote the book. And in fact, she found that her passion was teaching kids. So she actually went and trained as a mature student. I think she'd been in IT or something before. She did the whole teacher training program and did her B.Ed and is now a successful teacher. But the book I mentioned, and I've got that there because actually, if you do nothing else and you don't do a course with us or anything like that, I strongly recommend this book as a way of actually understanding how the power of words and the way that we speak to children, the way that we talk to them, messages that we give to them in our, when I say language, I don't just mean verbal. Verbal is very important, but also our body language, our facial expressions, our movements, all sorts of things. So it's a very good, simple introductory book. It's not terribly complicated, loads of theory. It's very practical and applicable. So I recommend that to people, to get hold of a copy of that book, to start thinking about using some of those ideas. We used to run, when Shakti, who's formerly worked with us in the family business, is a performer and also a therapist and has worked a lot with kids. She and I used to teach a 6-week course together to parents and teachers, childcare workers and so on came on the course. Sometimes both parents came. We had a couple who had triplets. Imagine having, I think there were 2 when they started the course, triplets to deal with. So it was a really, really useful course. We love teaching that, but I can't really take that on now because everything I'm doing at the moment is online, and also because mobility issues me and I find it difficult to get down there and do good modeling of how to work with kids and getting down there to the level of the kids on the floor. So I'm introduce myself just briefly to say that I'm the principal and co-founder of Transformations Institute, which was is still registered in the Middle East, but as I said, we're spending our time at the moment in Morocco, where we have a centre, and also we're planning to go back to the UK. I'm not going to go into a long thing about it, but we don't see ourselves working in Dubai because we're not prepared to be vaccinated or forced to do things that go against all our research. And so sadly, I don't think we'll be making personal visits there. We were spending our time across Morocco, Dubai, the UK, etc. But for since September, we've been here in Morocco. We were locked down in Dubai for 6 months, and that's why I say what I say about freedom of movement and expression is very important to me personally. It's one of my highest values. So I'm an educator, senior consultant, as it says, trainer and professional practitioner. That means a therapist, a coach, a counselor, but most of my time I spend training others to do that job as part of our heritage or legacy. I'm delighted to say we've got loads of people now in Bahrain and Dubai, the UAE, who've trained with us and who are doing a really good job. And many of them have also moved to other parts of the world. So we've got people in Australia and America and all over Europe and so on. And I also decided I would put this at the bottom because I started out saying, well, mother, grandmother, great-grandmother, and then I started thinking about families. And of course, I'm also a daughter. Even though both my parents are dead, I've been a daughter. And so it's different to be a daughter than it is to be an orphan or who doesn't have a parent figure. I'm a sister and of course, aunt, cousin, niece. So that's really just to say, I've done my duty of care in academia. I've served as a dean and director in UK and Gulf universities, etc. But my interests are practical. Applied positive psychology is what I'm all about, how we can actually use things to empower people, use information and knowledge. I think it was Dorothea who said, you know, the more I know, the less I know kind of thing, you know, that the more knowledge I get, the more I realize I know hardly anything at all. And I feel a bit that way too. I'm a lifelong learner. And once I was given a Women of the West award for my work with lifelong learning. And I said, you know, it's great and it's nice to have that honor, but I feel I learn just as much from the people that I work with as they learn from me, because everyone brings their own particular skills and insights. And working in the Middle East was great for nearly 20 years. I worked there because we had so many different nationalities. In one of our courses with 20 people on a diploma, 17 different nationalities. So we love working with people from all over. Okay, so in terms of how we present this material and what I'm going to give you an overview, a taster of today, is to put things in a context with a structure that's doable. And I say that because it is a huge topic. And there's so much information, so many theories about childcare, about parenting, about you name them. And because I actually started out my work in the field of personal professional development in that, I was a tutor for the National Childbirth Trust and a counsellor, and was involved in co-founding something called the Active Birth Movement, which became the Active Birth Teacher Training Course. So I worked with couples and with families and with parents at the beginning, and then I kind of more transitioned into individual work. So I've been exposed to a lot of ideas about psychology and so on. And as I said, to me, I like to take the things that are most practical, most applicable, that most people can make work, that we know how to do if we have a bit of guidance on it, rather than espousing this theory or that theory, or it must be done this way, or it must be done that way. And I've had 3 children, and I've got 2 grandchildren, one of whom has grown up with her own children, and I've got 2 great granddaughters and 1 great grandson. So I have seen an awful lot of different practice and different things being done, and some of it work very well and some not so well. So all kids are different, right? So I divide the teaching that I do up into these 3 sections. The teenies, and as you see, I've described this as being learning how to use your body, how to walk and talk. You were born without a manual or a handbook, so you need to actually work out how to use it. And your parents may make that easier for you by interacting with you, by helping to develop the neural pathways. We've got this potential of literally trillions of neurons in our brains, and making connections between them is how we start to make sense and think and feel and move our bodies. So if any of you haven't, it's a great idea sometimes to watch these speeded up videos where you see a child, you know, a baby that just looks like it's making random movements. And when they actually then speed it up, you'll see that they're making very specific attempts to reach for things, to point at things, to interact with the world but you can't see that if you're just looking at what looks like random movements. But when you speed it up and you see there is intentionality, there's that intelligence and that intention already right from the get-go. And I would say even before that, it starts in the womb. And we do look, when we cover this area, we do talk about trauma, mention about working with victims of trauma, with people who've been trafficked, etc. Well, many babies have gone through trauma when they've even been in utero, and they've had a lot of chemicals poured into them when the mother's been stressed, that have enabled them to feel stressed and distressed. So actually that sort of birth trauma, trauma in the womb is something that some kids actually bring with them, and some obviously more than others. Some very interesting research has been done in this area where they look at kids who are interacted with and those who are swaddled and basically put to lie down and sleep. Not neglected, you know, they get fed, they get changed, etc., but there's very little interaction. And when they actually looked at the formation of the brain, and they looked through using, using monitors before and then after, I think they did them again when they were a year and a half, the ones whose parents had interacted with them had already formed really loads and loads of neural pathways. They had loads of ideas, of thoughts, of cognitive development going on as a result of that interaction with other humans. So those who basically put the child away, you know, have the idea of it's best for children not to speak or interact, they just get on with it, are actually missing out, and the children are missing out on some great opportunities for developing earlier. So learning how to use your body, walking and talking, for those of you who work in the field of therapy or coaching, it's actually a great thing to think about this, because anybody who says to you it's difficult, I find it very difficult to learn new things, do things, etc. You've already mastered the two by far the hardest things that you ever have to do by the time you get to 7. And in fact, even sooner really, because you learn to walk. Most children learn to walk around the age of 1, 1.5, some are a bit sooner, some are a bit later, but average. And most children are talking to some extent or another by about 3, but by the time they get to 7, they've got pretty good facility of verbal, able to manage themselves verbally. The tweens, this is where basically between the ages of 7 and 12, and this is where you're mastering those skills that you've learned and starting to fine tune them, and also starting to look out beyond your immediate environment of your family and your circumstances, starting to look at your peers, starting to interact with others outside of the family. But often people make the mistake of thinking during this period that you're independent, that you're you can more or less do things on your own. Actually, emotionally, you're still very dependent on your family at this stage. And then the teens, which is where you metamorphose from the state of childhood into adulthood and independence. Though, of course, in let's say modern societies, I know there's plenty of societies nowadays that are still operating in traditional ways, but for the most part, the representation of life in media, etc., we have a very extended period of childhood. The word for it is extended neonacy. So it's basically you stay being a child for much longer than you would do if you were an animal or you're in a different sort of society. So often you have all these stages, right, of development. So you can do certain things when you're 13 or 14, certain things when you're 15 or 16, other things when you're 17, 18, etc. And many societies nowadays, the age of majority is 18. So even before you finished your teens, traditionally 21 in Western culture until the 20th century was the age of majority, but now it's 18. So of course, then you've got that phase when if you're going to university or doing some kind of apprenticeship, where you're still usually dependent on your family. And it's not until you're in your 20s that you may become independent. Though, of course, again, nowadays, many kids do move back home and can't afford to live independently. So these are the areas that I divide up what I look at each of those 3 stages in: physical development, cognitive development, and emotional development. And that's because all of these are going on all the time, but sometimes you have more of a spurt in one area, sometimes more in another. And so they're not going exactly, harmoniously or developing in the same rate. So when we're looking at working with children and families and the early years, that's 0 to 6, then I'm going to show you here a little mind map because I want to break it down a little bit into different pieces, okay? So if we start out with understanding the sources of trauma and problems, as I said, I'm based on experience, especially as I specialized for a while in breath work, and people would often have spontaneous regressions. They would go back to being born. Sometimes they didn't consciously remember things, but their body would start going through all sorts of movements that are similar to the way that the baby moves down the birth canal. As I said, one of my areas of research and interest was birth and was pregnancy, childbirth, and the early years. So understanding why a child might actually bring in some trauma or some distress with them and aren't completely just a blank slate when they arrive. Preparing strategies for common problems. It often amazes me how many people have not actually had any kind of preparation for parenting. And again, if you're living in a traditional society with extended families and you've had a chance to look after the kids when you're a teenager, etc., then it's going to be not so much of a surprise for you. But in the way that most of us live in the Western world anyway, in nuclear families, maybe in single parent families or blended families of some sort, many children have not been exposed to seeing other children grow up. They haven't actually been around a mum who's been feeding. Breastfeeding is a complete anathema to some people. They've never seen it done. If they were in a family where the children were fed, bottle fed, they why would they know the difference? So actually thinking about these things beforehand is why I got involved in parent education in the first place, because I would be quite shocked to find that some people had never even discussed whether they were going to have children before they got together as a couple. They hadn't discussed their ideas about parenting. Things like physical punishment. Should you do it or not? Big bust-ups over this, where one went, well, of course, it's fine to give them a slap if they need it. And you're not actually touching, physically harming my child, etc. Hadn't thought about their parenting styles, what sort of parents they wanted to be at all. And it was only really during pregnancy and if they got a chance to have some counselling or some parent education, then they might start thinking about these things before the baby came along. Often I'd work with people who'd already had their children. And so now they were trying to find out retrospectively what they could have done differently and better. So things like potty training, discipline, how you actually set boundaries, how do you actually answer questions, what's the right age to introduce certain ideas, should children be exposed to death, funerals, should they be protected or kept away from this? So many different things and so many different cultural ideas about this too. I discovered recently, there goes the cuckoo. I discovered recently, because we're in Morocco and hopefully we're going to live lots longer, but I thought I ought to find out what the rules are, because it being a Muslim country and so on, both my husband and I have wills in which we say we want to be cremated. And I discovered you cannot actually be cremated in Morocco. It's not allowed, it's not legal. So I didn't have a clue. I didn't even think about that. Why would I? I was going to be immortal, right? Like we all are when we're younger. So it's very interesting to actually find out something about the culture and what that means for you in terms of what you are and are allowed to do or not to do with your children. And that's a big, I'm not going to go into it now because there's not enough time, but there are lots of really important issues going on at the moment in the world, which mean that I, for one, I'm concerned about my grandchildren and great-grandchildren in particular because they're young, but I'm really glad that I don't have young children to parent at the moment, because there's so many ethical dilemmas and so on that weren't being faced before by people in the Western world, at least. Using play and fantasy. This is something, someone said they were interested in play therapy. This has become a really well developed nowadays. And again, there are some countries where you need to do a sort of a course and belong to a professional association to be a play therapist. But the therapists that I train and the coaches and the people that I train who work with kids and young people, actually most of them are not trained in play therapy, but there are so many things that you can do using play. There's Lego therapy. There are actually courses in using Lego as therapy, not just for kids, by the way, but for adults as well. In Bahrain, when I was in Bahrain, we had the Polytechnic counsellor there was an Australian lady who'd been trained in Lego therapy, and she was a play therapist, and she used it with staff and students in the Polytechnic there. But using play and fantasy with kids is really, really important. And of course, there are some great resources now that never used to be. I'm just going to show you one little one because it happens to be here. If I introduce you here to Aurora. Aurora is actually a dragon that we bought for my granddaughter, my young granddaughter, not the grown-up one, who is now nearly 4.5. And Aurora really wants to go and visit her in Switzerland and stay there. But at the moment, it's a question of how can she get there? And what we've been doing to maintain, we discovered that we usually see her about 3-4 times a year. Because of the situation globally, we haven't actually seen her for nearly 1.5 years. And so we have things that we were going to give her at Christmas and for birthdays and so on. And Aurora is one of those. And we actually also bought some books, which were sent to the UK where we were supposed to collect them, and then they've had to be sent on to Morocco. And these are some books about a dragon and a little boy called Drew. And the dragon is Diggery-Doo. And we've actually been reading all of these stories through Zoom so that she can actually enjoy those stories with us and talk about the dragon. And this dragon here, she's become very attached to. Oh, and I should have said, by the way, fix your dragon's attitude. Teach your dragon to love himself. Teach your dragon when he has to accept the word no. So there's all sorts of emotional intelligence built into those books that are really useful for people, both parents and therapists as well. And I don't know if any of you saw the movie Amélie, a French movie, but if you did, if you didn't, then do it. It's a great movie. It's a few years old now. Amélie steals a gnome, a garden gnome, from her father's house and gives it to a friend who's flight crew on airlines. And so there's all these pictures taken of the gnome around the world, at the Eiffel Tower, etc. Well, we take Aurora to various places. We take her with us. She gets photographed. She's been recently photographed going down a slide and on a swing and talking about what she's feeling and thinking, what's going on, what the dragons do, how they have to learn how to control their fiery breath, etc. So, as I said, this is just one of many props that you can use in play therapy that can be used for actually exploring emotions. Something else that I'm going to mention, which comes through all 3 stages, but is great to start out early. Any of you heard of Professor Carol Dweck? If you haven't heard of her, you may have heard of some of the ideas that are being used very influentially now in the field of positive psychology and in psychotherapy. It's her theory that she did her research on was called fixed mindset and growth mindset. Anyone heard of those? If you haven't been studying recently, there's no reason why you should do, but she's great. She's got lots of really good videos on YouTube and TED Talks and things too. She talks about the importance of the way that you give feedback to children. Her research showed very clearly that saying, I love you and you're great and how wonderful you are is not actually the best kind of feedback. What kids want and need is feedback that tells them what they do well, what they get from making effort, what they learn by not getting something right the first time, and gives them an incentive to go on. So feedback is something that you start very early on with kids in terms of giving them feedback on their performance, their behavior, what they achieve. And this is built into what nowadays we're calling in positive psychology resilience, building emotional and mental resilience in children, rather than, I expect you know some of the jargon words, but the idea of snowflakes, the idea of being woke, the idea of being very sensitive and touchy. There's a kind of a move to say it's not about stiff upper lip and so on, but it's about actually developing emotional and mental resilience. So that doesn't mean being a pushover, and it doesn't mean being a bully. It means being assertive, willing to take criticism in a positive way, etc. So that all kind of comes into the mix as well. If you're interested in play therapy, again, as I said, we show some on our course, we show some of the best people, but you can find stuff on the internet, people demonstrating using play therapy tools, sand tray work, working with different kinds of toys, doing growth mindset work with children, in some cases children who had a very hard time finding it easier to express themselves through play than through words. And of course, I know as an art therapist, you'll know how art can be used in that, but there are many other ways of using toys and, as I say, things like sound play Helping kids to overcome their fear and knowing the difference between stress and the flight or fight response, which is a healthy one that's built in for our survival, but most of the time in modern life, it's completely over the top. It's completely unnecessary. We don't need to be flooded with adrenaline. We don't need to be flooded with cortisol in order to handle the fact that someone wasn't very nice to us, or we saw a movie that was a bit scary, etc. And we need to know the difference. So play and fantasy, interestingly, are good ways to actually go into that world and then have a boundary, because play is only play when it has a beginning and it has an end. Dutch sociologist Jan Huizinga wrote very interestingly about this, that if children know that there's a play, then they have a boundary around play, and then we get on with the rest of life, and that they need those boundaries around play as well, and around overcoming their fear and accepting and acknowledging their feelings. This is about, again, the emotional intelligence to know that you've got that feeling, not to be told, no, you don't, or you love your sister, really, you don't feel angry with her, when actually at that moment you hate your sister and you do feel very angry, and you might say, I wish she'd never been born. Why did you go and get her? So children need to understand that their feelings are accepted, acknowledged, and then also talking to them about whether they're useful or functional, whether they help them or not. And I found that kids can be extremely sophisticated at understanding this, and they can take on quite challenging words as well if they get meaning behind it. Good communication, obviously, is the key. This applies to all the stages, but again, you're setting the foundations here for how you communicate. So creating a learning environment rather than an environment that's built on carrots and sticks, reward and punishment, okay? So a learning environment is where you feel safe to explore, to say what you think and feel, at the same time understanding what I was saying about boundaries. There's some things we don't do or say publicly, or we're careful when we say them around this person or that person, but it doesn't mean that our feelings aren't valid. And so if we can make that a learning experience, if we can make life a learning experience, then children actually enjoy the process of learning, and instead of it being associated with having to sit still, do what you're told, be quiet, etc. And the other thing that starts to develop during this phase, the earlier the better, is teaching kids to own and solve their own problems. And again, this needs to be appropriate, obviously, to their ability. I'd like to just share a little example with you of a fellow therapist. He's retired now, but we were talking to one time, and he said, you know, I've often wondered why it is that my son, when he was younger, would make such a fuss when his mum was around if he fell over and hurt himself or whatever, really made a big fuss about it. And when I was there, when he was around me, he didn't seem to do that. And so he said, I decided to just observe and, you know, in the background, and what happened when he fell over, say, and cut himself, and his mum was there on hand, and then to see what I did. And he said, what was interesting was that when his son came in next and had, you know, fallen over and scraped his knee, his mum went, ah, and she gave him big cuddles and hugs and said she'd kiss it better for him. She got the plasters out. She washed it, she made it all okay. She put on the plaster. She told him what a brave boy he was, and you know, she was going to make sure he was okay, he was safe, etc. And the little lad made a fuss and carried on sort of, you know, for quite some time afterwards, and mummy was there. Next time something similar happened, he kind of observed, a bit disassociated with what he did himself, and reflected on it just after. And what he did was, when his little boy came in and went, oh, look, I've scraped my knee and bleeding, he went, oh, okay, you need to clean that up then, don't we? And probably get some plasters. Okay, so he got the disinfectant or whatever, and he said, do you want me to do this, or do you want to do it? Because you know where it hurts and I don't want to, you know, what? And the little boy said, I'll do it. So he got the stuff and he cleaned up around his knee. And then his dad got out the plasters and said, oh, now these are a bit tricky to pull the little the tabs off. Shall I pull off the tabs, but then you put it on yourself and you put it where you think it needs to be? Yep, I'll do that. And so he did most of the thing himself. And then his dad said to him, great, okay, all right, now ready to get back and play? Yeah, sure. In other words, what he did was he helped him to solve his problems and let him be active in that process rather than rescuing him. And there's a fine line to say, you know, when does a kid need a hug? But in NLP, there's quite an emphasis, remember I mentioned NLP earlier, on when you anchor, which is to say you do something, often a physical thing, or it may be a word, a tone that you use, where you associate the emotion that someone's having, maybe the physical pain that they're having, with that emotion. And so if you say, when someone's burst into tears and they're feeling really unhappy, there, you poor thing, you're actually anchoring a feeling of being comforted and poor you when you're upset, rather than just being there, listening, breathing, building rapport, and then actually coming in when someone starts to maybe have a little watery smile comes through, then that's when you anchor. You actually do something positive, give a reinforcement there when they're feeling a bit better, when they're feeling on top of it a bit more. So again, there's a lot more I could say about that, but this is just to give you an indication of the sorts of things that, that we cover. If we move on from those teenies to the tweens, the 7 to 12-year-olds, you haven't really got much more except getting better, fine-tuning what you're doing at this stage, okay? Sorry, I clicked on too soon there. Okay, so you may be learning now to write, to read. You might have already started. In some countries, you won't be encouraged to do that really until you're about 7. In others, they'll start you off in kindergarten at 4, maybe even earlier. But the point is that you probably want to do it at this stage rather than being pushed. So it's fine-tuning. You've got all those motor movements already. You've got quite good control of your hands and your feet. And now probably you can skip and play hopscotch and start to dance and have a lot more control over your movements and your coordination. Again, though people are different, one of my great-grandchildren has microcephaly, which means to say, if you've never heard of that, that her head is a bit too small for her body. So it's affected her cognitive development. Her speech was quite slow. Once they realized what was going on, which they really didn't know, and everyone kept saying different things like, oh, probably autistic spectrum, oh, might be dyspraxic, might be this, that, and the other, as if a label helps you. A label doesn't help you. What you need to do is understand what's going on. If it's a physical thing, in her case it was, then you need to do something physical with it. So now she finally they got her into a special school, and she's doing extremely well. How old is she now? She's 8, actually, she's just turned 8. And she is now walking much more coordinated. Her speech is way better. She used to be terrified of bright lights and sounds, and now she actually makes music, and she does what do you call it when you sing karaoke. She has a karaoke mic, etc., because she's getting the right kind of stimulation and development. So I just want to say, you know, everybody's different, and you can't really help a child by giving them a label. What you do is find out what helps them to develop, whether it's physically, cognitively, emotionally, or all three. And usually it is all three, even when it's a physical problem to start with. So this is the stage where children are often much more able to verbalize and express themselves, but don't make the mistake, and it really is important to be aware of this, emotionally, they're often not nearly as savvy as they seem to be with their vocabulary, with their concepts and so on. So cognitively, they're often well ahead than they are emotionally. So cognitively and physically, they're getting very good, very smart, very able to handle their bodies, but emotionally, they're not so smart. And it's important to keep that bond close and to not just assume, okay, they're with their friends, that's okay. They don't need mum and dad, they do. They do need their family around them. And their main concern from the ages of 7 to 12, the big question is, am I good at what I do? They really want to be good at what they do. They want to get that feedback, and feedback becomes really important in terms of what I was saying before about the growth mindset, encouraging them to actually not measure themselves by others, which I know is really difficult in school and the education system, but by how they do. And if you haven't come across Professor Sean Acor, he pronounces it, I believe, it looks like Acor to me. It's an American psychologist who now runs his own company, but he was a professor of psychology at Harvard for years and did a lot of research both at Harvard and in the corporate sector. And then he traveled and did research in Africa and Japan and so on. And what he found was that his subject of research was happiness, because psychology had studied fear for so long. Pain and fear seem to be the main things. And now in positive psychology, it's about happiness, about resilience, about what makes people better, what makes them cope better. And so what he's been doing is looking at what he calls the outliers, not the people who are merely average, but the people who do really well at what they do. How do they do it? What do they do? And modeling excellence, which is very much a principle in NLP that I mentioned before. Positive parenting, and again, this is true throughout all the stages, but I'm looking at it now in this tween stage. Nurturing self-esteem and resilience by understanding and accepting children's learning needs and their problems, highlighting their strengths and to work with them on strategies to overcome their difficulties, how to solve problems and make decisions. If you do all their decision making for them, if you rush in to help them with their homework or take it over for them, then you're not actually helping them to develop. And reinforcing responsibility by having them contribute. This is something that a lot of parents find it very hard to let go of. The idea that as a parent, you have to make the decisions. Well, yes, there are some that you have to make, but there's an awful lot that you can do in between. So this is the stage where, if you haven't already, having things like family meetings, where once they've got used to the idea of what a family meeting is and having it at certain times and having certain ground rules for it, once it's established, the children can actually take it in turns to be the chair. So it isn't just the grown-ups that run the family meeting. And it's really interesting to see when children are involved in their own process of learning and given responsibility to go along with their accountability, then they actually feel very confident about doing that. And it helps them tremendously in the process of interacting with other kids, and not only in schools, but in life and in relationships in general. So if they haven't had all the decisions made for them, if they've been included in decision making or even given decisions to make for themselves, they're far more willing to own what's going on. To help them to learn from, rather than feel defeated or a failure by mistakes. You know, in NLP, one of the 8 presuppositions, that's the if you like, the holy book, the commandments of NLP, is feedback, not failure. The F word, as a bad word, is failure. So whenever you do anything, you get feedback. So if it didn't work out the way you wanted it to, you can learn something from it. So actually, again, I have to say an awful lot of education doesn't operate on this principle. 3-minute tests, tick boxes, getting it right, and all of that is so often the aim of education, not so much in the early years. This is why kids often like kindergarten, that they can play, that they can learn through play, that learning is fun. But once you start getting into competition, academic pressures and all the rest of it, where you're not only working all day in school, but you're doing homework in the evening, where you don't get to play. And then when you do play, it's on a computer and it's all that sort of stops you from concentrating and makes you do everything on short-term basis. That's not good learning. Good learning is where you have time to ponder, make connections, daydream, think about things. That's how just about all breakthroughs have happened in science and in technology, in the things that we have in the world today. It hasn't come about by somebody being pushed to do things quickly. It's come about by people making interesting connections between things. It's why polymaths, that's to say people who have knowledge of lots of different subjects, who are interested in music and art as well as in science or history, they often are the ones that make breakthroughs because they see new connections between things. And that's, by the way, reflects how our neural pathways work. Our neural pathways work, we develop our brains and our astonishing ability to think by actually making new connections between things. So you want to start that off early. And making the child feel special, having individual time for each child. This is something, again, I find that parents, it's understandable because it's useful to bung them in together, entertain each other, give you a break. But actually each child, especially where there are multiple children in a family, needs special time to themselves with their parents, whichever. And very often you find that the eldest miss out in that way because the eldest are supposed to look after the little ones, right? They're supposed to be responsible. And of course, eldest, and if we're talking about women, particularly eldest daughters, who are the eldest child in the family, are often the achievers, but also they're often the ones that get very pressured and very stressed and can be perfectionists and so on, because they feel that they're responsible for everything. So it's a double-edged sword, that one. So a positive parent reflects on all of these things and thinks about how can I actually, in practical terms, make this work. And then the third stage is the stage of working with teens. So 13 to 19 technically is the teenage years. And of course, that's a huge gap, isn't it? You know, it goes from being pubescent, only just developing sexually, just sort of coming into maturity physically, right through to the point where you are pretty much an adult. And in some societies, you would have been out already, helping bring in the food or looking after the home, looking after other children, etc. So the preoccupations of this adolescent phase, from puberty through adolescence through adulthood, me. And it's not really an accident that people talk about me generation. You know, it's something, since teenagers were invented, which some of you may know, the concept of a teenager wasn't even developed until the 50s and 60s. But their preoccupations, and I'm sure this existed long before the word teenager, adolescent preoccupations, who am I? Am I okay? But the who am I? Before the 7 to 12-year-old was saying, am I good at what I do? But who am I? And the big questions about who am I? What do I want to do? What do I want to do with my life? So what am I going to become? And of course, there's a lot of pressure on children for this. Parental expectation, teachers and education expectation. And yet the fact is, nowadays, especially in the modern world, we don't actually know. Those children do not know what they're going to be doing. They say that most of us can look forward to at least 2 or 3 career changes in our lifetime with current life expectancy. So you don't actually know what you're going to do. Now, of course, it's true that certain professions, it's more difficult to get into or break into if you haven't had a sound scientific or mathematical education. In the liberal arts and the humanities, it's possible to start those at any age. More tricky, as I said, if you want to be an engineer, a scientist, a physicist, a doctor, if you don't start out fairly young. But even then, I know people who've trained as lawyers, as doctors, etc., well into their lives, but it has been much more of an effort to do that. Sex, drugs, rock and roll, okay? All the forbidden fruits, all the things that you're not supposed to do. And of course, nowadays, I find particularly with, if I take the drugs, okay? According to many researchers, vast numbers of adults in the Western world take drugs. They take prescription medications, and many of them take them for emotional problems, for which, in my personal opinion, and I'm always happy to defend that if anyone wants to question me on it later, for the vast majority of people who take them, they're absolutely useless, and in many cases actually make things worse, not better. But they're told, you know, don't take drugs. Drugs are bad, and yet they see parents, adult influencers, people around them are taking drugs. It's just their prescription drugs. And many of the drugs that are given to kids, especially around this sort of age, who are told that they've got ADD or ADHD or some such label, are hardly any different chemically from cocaine. So, you know, I was talking to a young Saudi guy who was a student at university, and he came along to one of our workshops one time, and he was telling me he's Saudi, but he was studying in America. And he said, most of the people I know go and exaggerate their symptoms to the doctor so they can get extra Ritalin or Adderall, and then they sell it to their friends so that they can do all-nighters, they can stay up studying when they're preparing for their exams, etc. It was normal to have that currency of using prescription medication in a recreational, or in this case, maybe not so recreational way, more of an attempt to do last-minute swatting. So it's a problem. In some countries, as we know, alcohol is illegal or frowned on in some cultures, in some religions, and in others, it's part of the norm. It's part of the norm for the culture. Very difficult for children who are brought up across more than one culture. Sex, of course, the sex urges going on. Now, again, I'm quite happy to be questioned on this and pulled up about it later in the Q&A section, which I've left plenty of time for. But what I'm going to say about this is personally, and I'll say it to whoever, whenever, and I don't mind that it's live streaming, etc. The idea that a child pre-puberty can know for sure what their sexuality is, what their gender is, to me is absolutely ridiculous. And the idea of preventing puberty from happening by using medication, possibly even surgery, though that's usually done in teens, to actually transgender a child from one sex to another, to me is far short of criminal. And I will quite happily justify that position to anybody. But children are going through changes. Children are going through all sorts of changes. They have no idea what they'll be like once they've gone through those changes. So the idea that conceptually they can have an idea of their gender before that, to me, is absolutely wrong. And I say that as someone who teaches, as I said, in this field. So people need to know I'm not going to sit on the fence on that one. And I'll quite happily defend my position. They can defend theirs. We encourage discussion and debate and opinions. But for me, how can you know who or what you are? And I've heard a lot of lesbians talk about this actually as something that they're very concerned about, because, and also women in sports, because it actually makes a difference to what it means to you to be a woman if you know that someone who was a man actually now can compete directly with you as if they were the same. So this is one of those areas that people get very heated about, and you know, you've got Jordan Peterson on the one side, and the trans, you know, whatever on the other. And I find it, as I said, I find it interesting to listen to people's opinions. I very rarely say this is my idea. On this particular one, I do speak out because I think it's very, very risky strategy to go down. And I also have communicated with people who later in their 20s and even 30s deeply regret that they actually had surgery and chemical treatment, chemical, you know, castration or whatever to alter their chemistry, and have reflected with a therapeutic environment to say, actually, I think I was just emotionally very messed up, very stressed out. And it was easier to put everything on that, being in the wrong body, the wrong gender, or whatever, sexuality, and all these things. That was something that was actually something I could put my focus on rather than deal with the issues underlying it in terms of my emotional unhappiness, my psychological state. So I mention this because it's very fashionable at the moment, and there are schools in the UK, I think somebody from the UK, I was reading about one where something like 75% of the girls in the class actually believed that they were in the wrong body and that they should have been boys. Now, when you get that kind of percentage going on, something's happening that's not the occasional person just saying, I feel I'm in the wrong body and eventually I want to do something about that, which I totally understand and have worked with clients in that position. So this transition into adulthood, I was talking about this before, is very tricky because there is not one point at which you say, that's it. You know, you have, in girls' case, obviously, there's the onset of menstruation. With boys, not that simple. The voice goes up and down a bit. They may or may not need to shave earlier or later, etc. But it's a gradual process, a gradual unfolding. So it's quite a difficult time for them and also for their parents, who are constantly attempting to often treat them as they did when they were a child, a younger child, and they're not that anymore. But at the same time, they don't want to, as they say, throw the baby out with the bathwater, because they know that they are a responsible adult, they are still the parent, they are still funding the child. So unless the child, well, they're still a child, but does leave home, goes and becomes independent, then obviously there are certain rules, certain ground rules, certain things that need to be negotiated. But the process has to be much more hands-off as that child grows older. However, in some societies, as we know, and in some households, suddenly mum or dad, whoever was very lenient before, very easygoing, suddenly starts to become very strict. And naturally, they're worried. They're worried about, if it's a daughter, that she'll get pregnant. They're worried that they'll be in a situation where she won't be able to continue with her education, or she maybe will find it difficult to find a partner, etc. I found it much more amongst parents of girls than of boys, because with boys, there's often a bit of an attitude of kind of, they're sowing their wild oats. Well, you know, we don't have to live with the consequences. Again, that's a huge generalization, but I found that. Parents tend to get more worried about girls because they're the ones that can become pregnant. So this whatever, I was shown this a few years ago now, relatively recently in my life, okay, when I did this, and what was it? Oh yeah, see my hand? And I said, oh yeah, talk to the hand. And my daughter said to me, oh, Mum, you're really out of date. You're really not down with the kids on this one. And I said, why? And she said, it's this. And I said, well, what's that? And she said, I said, is it giving someone the elbow? And she said, well, you know why? And I said, no, tell me. I have no idea. I thought that was the cool thing, you know, whatever. She went, you talk to the elbow because you're not worth the extension. So I got educated on that one. But, you know, it's constantly a special way of speaking, special talk. You're different. Your parents never understand. They never had sex. They never had complications. They never were an adolescent. So teenagers very much in that category of thinking they're not understood. And I'm making jokes and making light, but of course we've got now far more attempts at suicide, even happening in the tween years, not even waiting till teens. And we have a great increase in juvenile depression, anxiety conditions, self-harming, all that sort of stuff that is way, 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 way bigger than it used to be. I'm not saying it never went on or that people didn't have eating disorders and self-harm or OCD or whatever. I'm talking about the scale that it's on, and particularly with this phase of this year or so that kids have been going through, not going to school, getting exposed to all sorts of conflicting ideas on the social media. Their parents may have different ideas from each other or from their friends. And I predicted last year that we'd see a big change in the sorts of people coming forward with OCD, because you would have the germaphobes who would now be saying, see, I was right, I was justified. It's not dysfunctional to be worried about germs. And they're actually, some are feeling justified and actually that they are being validated by the fact that now mask wearing, etc., social distancing, cleansing, all these rituals that would have been seen as OCD. So that's an interesting one for those of you who work as counselors and therapists, is how are you going to deal with that one? What's defined as dysfunctional and what's defined as functional? And often you'll get multiple issues. Was a client of Dr. David Cato, who I didn't give his name, but I mentioned before, who actually had such multiple issues that he'd been on, I think since 12, had suffered depression. At 14, was taken to a psychiatrist. Between 14 and 16, saw regular psychiatric assessments and saw a counsellor, a psychologist who was a counsellor in between, and made several suicide attempts, several overdoses, which were unsuccessful. And finally, at the age of 17, I think it was, threw himself off a bridge, which is usually going to be a successful suicide. In this particular case, he wasn't. He was rescued, but he was so badly injured that he was in hospital for months and months, had to have multiple surgeries on his face because of disfigurements from the jump, and multiple breaks in just about every bone in his body, and eventually was released, eventually came out the other side. I mention this because this is someone who'd been on medication. He'd had all sorts of interventions. It wasn't like someone who couldn't get any support. He had about half a dozen sessions with David, who uses a combination of CBT and hypnotherapy. And he marked himself, because David does a self-assessment, suicidal thoughts, no more. Anxiety, about 99% better. Depression, same thing. So it was all up in the high 90s. I think view of self, of appearance, confidence in own appearance was only in the 80-something%. But when you look at where he was, and David followed up with him a few years later, and he actually said, I went back to college, don't care what people think, and now I'm working in a bank and about to get promoted. So I just mentioned the fact that good psychological therapy can be extremely effective for even people with multiple issues. But I'm just saying, we're back to this thing, what kind of therapy do they get? Does it encourage them to be resourceful and resilient? Does it encourage them to start to understand their own brain, their own emotional intelligence, their own anxiety reactions, their stress functions. A lot of it doesn't. And so a lot of psychoanalysis and a lot of psychotherapy has not been particularly successful. And so, you know, there's a kind of a, well, it's the culture now for the last few decades is basically it's chemical, it's brain chemistry imbalance. And actually there's no evidence for that whatsoever. But I just mention these things because there are lots of them around and lots of teenagers are going online. They're self-prescribing in terms of, they're self-assessing, sorry. I've got borderline personality disorder. I think I'm schizophrenic. I'm bipolar. So they'll go on an internet site or in a chat room, and then they'll decide what they are. They won't even necessarily go and get that diagnosis from a psychiatrist or a doctor. So there are mixed blessings to the information superhighway when it comes to people labeling themselves, never mind other people labeling them. So a few tips, top tips for parents here. Comparing with others. Again, this applies to all, but I'm focusing on this final section. Avoid making comparisons with others. Question, but don't argue with self-deprecating comments. You know, when they put themselves down. No good saying, "Oh, but you're lovely," or "Of course you've got lots of." No, you listen. You might challenge that. Okay, what makes you say that? What gave you that idea? So challenge. It's what we call in cognitive behavioral therapy, Socratic questioning. Ask questions that get them to dig a bit deeper and be specific, get them to give you specifically what it is that they mean by that. Avoid false modesty and encourage self-respect and pride in their abilities. I was brought up in a generation who was told, don't be a show-off, don't be a notice box, don't put yourself forward. So sometimes it was quite difficult if you knew the answer and you wanted to participate and you wanted to say something, because then the other kids will go, "Oh, no," or show off, etc., etc. And sometimes teachers don't even like it when a child says, you know, you said such and such, but didn't you say something else then? They take that as cheek. They take that as rudeness. They take it as being questioning and don't like that. I'm not saying all teachers, but there are plenty of teachers, unfortunately, who are like that. And parents, of course. Whenever they do something praiseworthy, praise them, but remember growth mindset. Praise the effort they put in. Praise their persistence. There's a very interesting book called The Luck Factor by Professor Richard Wiseman, who's someone who's a psychology professor who also popularizes psychology and science in a really good way. And he talks about his research. He was the first person ever to do research on luck. What makes a person lucky? Is it just something we can't explain, or are there certain psychological characteristics? And surprise, surprise, he found that things like persistence and resilience, a willingness to go up and talk to people you don't know, making connections, communicating, looking out for learning opportunities, all sorts of things that we would say in positive psychology are beneficial. He found that those were the characteristics of a lucky person. And the great news is that you can actually train yourself to do those things. It's not something that you have to be born with. So even a shy, reserved person can teach themselves. They can modify their behavior. They don't need to go into a lab and have it done to them. They can start to change their behavior by changing the things that they do. And this is the great thing about having neuroplasticity of the brain, that we can reform those neural pathways and make new habits. So giving the praise and approval in adult ways, being specific, using assertive communication, recognizing effort and intuition, and intention, not just the results that they got. Don't nag, okay? It doesn't work and it just feels bad for everybody all around. And teenagers get very, very good, especially at what we call fogging in assertiveness. That's to say, yeah, you're right, going along with what you're saying, but with no intention of actually doing anything differently at all. So you need to find other ways to communicate rather than just nag, nag, nag. Criticize only when you need to and do it constructively. Always point out some alternatives, some options. Encourage them to be kinder to themselves. Kids are often their own worst enemies. They're very tough on themselves. So one of those books, of the dragon books I was telling you about, is Train Your Dragon to Love Himself. So actually loving himself and not giving himself a hard time or comparing himself unfavorably with others. So try to parent rather than to mold as they get older, guiding rather than taking over. And again, even when small, we know that a small child will make a big mess if they're helping you cook in the kitchen. But unless you let them do that, and learn from that, you're not going to get help from them later when you say, why don't you come and give me some help in the kitchen? Why don't you come do some cooking? Because I learned from an early age that it's not okay to make a mess. It's not okay to not do something really well, etc. Remember that your teen's first influence is their parents. There's a typo there, that should be that. Are there self-esteem issues that you need to work on yourself? Behavior and attitudes tend to run in families. And this is where when people say, oh, it's genetic, or it's in the genes, your mum was depressed, your dad was depressed, your uncle was depressed, etc. Remember that children have mirror neurons. That's how we learn. That's how we learn for the first 7 years. Those motor skills that we're learning and all of that are learned by mirror neurons, just modeling, copying everything that we see. So if a parent's depressed, if a parent's unhappy, they don't need to tell their child that. Their child can see that for themselves. They've learned the language. They've learned the breathing patterns. So if you notice that your child is anxious, worth having a look and asking yourself, am I an anxious person? What could I do about my anxiety? Do I tend to project my anxiety and my worries onto my child? Because I've never yet seen an anxious child where there hasn't been some anxiety in the family. I'm not saying necessarily the parent, it could be another influential person in the family, but kids learn by watching mirror neurons, right? So mirror neurons are really important. So make sure that you model the behavior. It's no good saying to a child, don't do what I do what I say. They will do what you do for the most part. So those are some things that are worth bearing in mind. And you might want to think about this also in terms of the role of a parent. So if I take those three areas, the manager, the parent as a manager, right? Make sure their teenagers got it. And again, I'm saying teenager, but you could look at any of the stages with this. Ensure that they've got enough food and money, that their survival needs are met. Any of you have looked at Maslow's pyramid of needs? Often you see it in management courses as well as in psychology. And we've got survival needs, right? Food, shelter, keeping warm, etc. Physical survival. Then it goes up. We start to get into emotional needs. We have safety needs. We have a need to belong to a family, a community, to have esteem, to be respected. And at the top of that pyramid is self-actualization, is what Maslow calls it. Jung called it individuation. It's the idea that in coaching, it's talked about that performance equals potential minus interference. So, okay, it's important that you have those survival needs met, but so often parents are so busy doing the survival bit, doing the manager bit, that they don't have enough time for 2 and 3, which are equally important. So nurturing and caring, showing love and affection, whether the child brushes it off or doesn't want to be kissed in public or whatever, you can still tell them that you love them. You can still let them know that you care about them, that they are important, that you are important to them. Teenagers also need clear boundaries, but it's about listening without judging. You might not agree, but you're not going to judge and put them down. And also, you have to make moral choices as the parent, it's true, but you need to be prepared to discuss those and to have them challenged by the teenager without freaking out and without getting defensive. Teenagers rate the roles of nurturer and guide as more important than the management role. Now, you might say, well, of course they would. They take for granted there's food on the table, etc. But actually, these are really important things. So a parent that's busy working all the time to earn the money to pay their school fees or buy their clothes or food is missing out if they don't spend that time on the nurturing and caring, and also on the guiding and talking through the choices. Lots of teenagers turn to their peers to get information, to decide what to do. And of course, a lot of their peers are no more wise than they are and often full of misinformation and aren't likely to give them the best kind of advice. And a question I've raised at the bottom is because it comes up a lot. Who is parenting your teenager? Is it you or the internet? Is it TV or is it other people? Kids, their families in your neighborhood, the peer group, the gang. When I lived in Bahrain, I can remember a number of women complaining to me and it was usually women complaining to me about how their children had got Filipino or Sri Lankan accents, and that they were speaking English and Arabic with an accent. And my response to that is, well, where is your child learning to speak? Who are they learning to speak from? Who are they spending their time with? And it was mostly the nanny or the housemaid or whoever it was that the parent was leaving them with most of the time. So my response to that was, if you want your child to have the same sort of accent as you'd better spend a lot more time talking to them. And, you know, actually having the chance for them to model themselves on you, not just other people. And of course, the internet and TV. TV is so pernicious, isn't it? So easy to just shove them in front of it. I watch this happen with my great-grandchildren a bit, you know. You can have the computer game on for X amount of time, or you can watch BBC, the CBBS, or watch Peppa Pig or whatever, which is fine, you know, for a short time. But if that's what you're doing repeatedly, that's what that child is learning. They're learning what they see on cartoons, in movies, etc. And they're not learning from you. And if you think about watching a TV or playing a computer game or anything, it's not like a card game or a board game where you sit around a table together. You sit in a row, right, and you watch a screen in front of you, and all your attention from everybody, quality time as a family watching TV, you're all just watching the TV. So I often ask people those sorts of questions when they're complaining about their teenagers and what it is that they like to spend their time doing. And the number of them who are going through a hard time now, more than ever, because during the period of lockdown, they've been exposed to far more TV and internet than they would have done when they would have been out playing or out physically outside in the air. And of course, even schooling's been done online as well. So there's a big issue around that. So those are the things that that I wanted to cover with you. And I've left myself a good 15 minutes, I think, to talk to you and ask you if you've got any questions, any observations, anything you want to challenge me on, which you're welcome to do. And to just mention to you that we've got this short intensive course where we go through each of those stages that I've given you just a brief taster of in detail. So we go through the cognitive development, the physical development, the emotional development of each of those stages. And we also have case studies. We do exercises, dialogues, situations. What can you say? What would you say to the child? What would you say, etc., etc. So it's quite interactive. And you get masses of materials, a huge amount of resource material to take away, to actually use, play with, study, learn, put into practice preferably. So that's really all I want to say to you in terms of my presentation. So I think there are 10 of you still there. So anybody got any questions, observations, challenges, please go ahead.
Hi, can I just ask a question?
Please go ahead.
Yes, on the course, because yeah, I just wanted to find out about the cultural aspects of your course, because it's quite a wide subject, and we know that one box doesn't fit all, and I work very much from a cultural point of view. So a lot of the psychology that I incorporate is things like Black African psychology and other types of psychology to work individually. So on this course, can you explain a little bit more when it comes in culturally, because everyone's going to be working with different people, diverse. I think this is something that's really important. I think it's really lacking as well.
Yeah, I agree with you, and I think you know, you're quite right when you say it's a big topic. Obviously, with a 2-day course, there's no way that I can get into any detail. My job is to focus on focus on the things that are the universals, like the language, the body language, the facial expressions, the behavioral science that we have that's pretty sound, and 50 years, you know, have gone into that sorts of research, to look at the linguistics and to look at the developmental things, which are, again, pretty universal. There may be some variations in different groups, but what I certainly do is I raise the issue of culture. And because of my courses, I said, they're usually pretty multicultural. So people in the discussion bits, you know, when we have what I do on Zoom and so on is use breakout rooms. So when I have people discuss things, If there's something that has a cultural element to it, or they go, "Phew, in my culture, that would be really difficult to say no to a mother-in-law about, you know, this when she's doing this to my child that I don't approve of." You know, I mean, just to take one example that comes up a lot when you have families who are in Dubai, for example, who've got culture from, say, they've got relatives, they've got in-laws or parents living with them who've got very different kinds of cultural standards than they have themselves or that their kids have in school. So these kind of things come up in the discussions. As I said, it's raised by me, but probably in something like, in your own case, you work in particular groups, I might well say, okay, so what would you do to handle that? You know, go away and have a think about that. I know that, for example, when I used to teach many years ago in London, and as you know, London is even more so now, but then it was very multicultural, but it was more, there were more areas. So as it happened, one of the places I worked was in Vauxhall, and we had a large amount of the Cambodian, it wasn't the first wave of the Vietnamese, it was the Cambodian boat people coming in. And they couldn't have been more different from the groups that had come in, say, from the Asian cultures, because they wanted to integrate. You can't imagine how much they wanted to integrate, you know. They were wearing the baseball caps, they had the Coke bottles, they had whatever. And one of my friends who was a midwife was working in a hospital, and she was, I knew her from the National Childbirth Trust. She was telling me, it's really strange, you know. She said the women young women who are coming in and having their babies, when they first come in and they first arrived, that you can't get them to stay on the bed. They get down, they get on the floor, they squat, they do all the active birth stuff. That's just how, you know, their culture, they do it. And she said that the sad thing is, they'll come back 2-3 years later to have their next child, and they're up on the bed, they're insisting on having, you know, the gas and oxygen or the meds or whatever. They wanted epidural, because they've learned that's what you do. If you're integrated, this is the way we give birth there. So I just give that as one example of how it's so complex and so so dynamic, you know, that in not even one generation to another, but within the same generation, you can have big changes. In Bahrain, you can imagine, we had a lot of people who were mixed, who'd got, for example, their father had gone to Ireland at that time. Now they've got a Royal College of Surgeons in Ireland to have a place in a teaching hospital in Bahrain, but then they used to have to go to Ireland. So then they would marry an Irish woman, then come back to Bahrain. And those kids, they were in a whole category of their own. They had their own labels for themselves as being this mixed, and they would often veer from being covered. The girls, you know, would wear hijab, etc. And then others wouldn't, or they would suddenly change. And then that was really difficult for their children because they'd been raised with a mum who was covered, but then she wasn't anymore. So then that was very, you know, all these things that we're seeing that you're talking about in that sort of cultural sense is so individual that each person with their particular group needs to adapt what they do to that particular cultural group. And even knowing within that cultural group, there'll be differences between them. I don't know if you ever saw the movie, it's quite a while ago now, Baji on the Beach. I don't know if you ever saw that. It was about
no, I didn't know.
Yeah, Indian family living in the north and from the subcontinent India, and then their mums had tried to preserve as much as possible of their culture. And then there's the girl in the family is dating a West Indian young man, and she doesn't want the family to know. She knows she'll get all sorts of stuff for this. And then the aunt comes to visit from Bombay, who's the same age as the mothers. And she's shocked at how old-fashioned they are and how out of touch they are, because Mumbai, you know, is not like it was when they were there, when they were young women. So you get this really interesting, you know, that the mother country is actually far more modern in its attitudes in many ways than the culture that they've tried to preserve for their children's heritage, you know. So it's a great question and a good topic. But as I said, I wouldn't claim that we spend lots of time on that because we have 2 days to cover all the key things. And so my focus is on skills and applied positive psychology and how we would deal with certain situations. But, you know, if you were there and you're part of it, you'd be very welcome to say, look, if I have this, that, and the other going on, how am I going to handle that? And you've got so many different expectations, different cultural sensitivities there. So it's maybe you'll be running courses yourself in that when you're back in the UK and taking them into the parents and the teachers who need them.
Yeah, thank you for answering my question.
You're welcome. Anybody else got a question or an answer, an example, a challenge?
I think there's some questions that have been written. People have
Oh,
written.
in the chat box? Right,
Yeah.
I haven't been looking at that because I've been having the slides on and so on. Well, I can tell you what, I can stop the share screen and then bring people back. Hang on. That's not, why is it not allowing me to, if I go back there, new share, right, if I take out share, stop sharing. Oh, Bradley, thank you for your comment there, shoot off. Okay, let me just, I'm trying to get rid of my slides. I'm having difficulty with that. Pause share. Right, I think I've done it now. Okay. Yes, okay. No, it's still there, even though I've said to pause the share. Okay, so I'm going to just scroll up. Okay. Right. Okay, therapy, same one, up in the hills of, right, that was Bradley. He came to another one that I did. High winds and rain at the moment. Okay, we had Kim from Australia. I answered the question about the slides already. The cost of the course, Leila, I think it's 1,600 dirhams plus VAT, which is 5% in Dubai. So I'm not sure what that is in your currency, Kim. For your in British currency, I think that's about 320-ish euros, so probably just under £300. I'm not, but just check with Illuminations because they usually put the price in dollars as well. How to stop a child from being addicted to social media, because my daughter's changed so much and now has some mental health problems because of social media. Yeah, it's something that obviously in a few minutes I'm not going to be able to address, but it's certainly something we talk about on the course, and we talk about that in terms of what does actually addiction mean, because addiction is not really the same when it's an emotional and habit issue. It's a habit. A true addiction is where there is a physiological dependency on something. So for example, one person could drink a lot of alcohol but not be addicted to it. Somebody else, their body's adjusted to it to the point where they go through DTs and withdrawal symptoms. But social media is not going to be that way. It does have some, I'm not saying it does have some effect on the body, because obviously it affects the brain and perception centers, but it's possible to change a habit quite easily once you know what the habit is, what it's about, what's it being used to do, what is it that the person really wants from that, because we are seeing, as you quite rightly say, many people who've got mental health problems because they're spending all their time on social media and they're not making real connections with real people. They're not actually communicating with people that they know. They're not actually interacting with people that they physically can. For example, I mean, my classic on this is people think differently when they're in a car, for example. You know, if you're sitting, those of you in Dubai, on the Sheikh Zayed Road and there's a traffic jam, it's not unusual to look up and see somebody digging in their nose like this, pulling it out, having a look, and sometimes even putting it in their mouth. Now, you would not do that in company, right? You would not do that. You probably wouldn't shout and swear at somebody because they got in your way if you were physically there. But in a car, people start behaving like lunatics. They start behaving, you know, really, really strangely. So on social media, people behave differently than they do interacting with real people. So my answer to that is to say, actually interacting with someone and getting them to understand that real people and people online are different, and that real relationships with people are what's important. Communicating with people is what's important, to understand body language, to understand facial expressions, to understand that when people put an image on social media, it's just that, it's an image. It could be photoshopped, it could be airbrushed, it could be them telling their, you know, a typical teenager diary about, oh, I had a great time, went out, got drunk, had sex, you know, probably none of those things actually happened, or you certainly weren't happy about them, but you present it in a certain way because that's how you're supposed to be. So I think actually talking to the child and getting them to see that they can substitute, I was talking about anchoring earlier, something else that gives them the feeling. I mean, I actually have helped many people over the years stop smoking using hypnotherapy, but when I stopped smoking, it was at a relatively young age, and you know what? I'd stopped smoking for a year by just willpower, stopped. Okay, that's fine, I'm not a smoker. And then I thought, oh, I could have a smoke now and again because I happened to live with someone who was a social smoker, which is very rare. In other words, he could smoke one evening at a party and then not smoke again for months. And I thought, oh, great, I'm not a smoker now. And I'll just have one just to see what it's like. And within a week, I was back on a pack a day. So after that, I was a smoker for probably another couple of years. And then one day I was smoking and I thought, this really reminds me of something. What is it? It really reminds me of something. And as I was doing this, it was one of those moments where I'm very happy. I had a light bulb moment and I thought, it's breathing. It's breathing. Oh my God, what am I doing this for? And I went out and started doing yoga and practicing meditation and doing the sorts of stuff that gives you a real buzz from your breath, from your breathing. You don't need a cigarette to do it. So finding things that people can actually substitute for the harmful, dysfunctional, negative habits they've got, that they get pleasure from, that they enjoy, is usually the answer. Not taking something away from someone. The old carrot and stick. People need to feel motivated. They need to have intrinsic motivation, something that comes from within themselves, that they want to do things differently. They want to have a different experience. And if she's unhappy and has a mental health problem, then clearly it's not functional for her. So I don't know if that helps at all, Katia, but certainly I know people that I could refer you to who work online and have got great groups going and things. So they do things online. But one lady in particular I'm thinking of, who was a graduate of ours, she was a teacher before, and then she trained as a therapist with us, and then she did her master's in applied positive psychology with a British university that we recommend. And she runs absolutely brilliant services for kids. And she's very much used to the sorts of problems you're talking about. And she has kids mentoring. Once they've been through her programs with her, she's now started to get the ones who've really learned a lot about themselves, who've taken a forensic approach to understanding their own psyche, their own emotional intelligence, and they now mentor other kids, and they coach and mentor other children who are going through similar things. So if you're interested in that, if you, I'll put my email address in here if anyone wants to send me something personally or privately. It's Dr. Layla at Transform, a bit like the website, transforminst.com. And I'll put in my WhatsApp for WhatsApp messages as well, which is now a Moroccan number, not a Dubai number anymore. So if anyone wants that, that's there. Obviously, I'm not going to be providing the wings in here too. It's just not something over my fireplace. I'm not providing free therapy, but I'm very happy to refer to people who do a great job. Does the program include how to deal with children after having been victims of abusive environment or chronic fear, shock, trauma such as deportation, war, etc.? Again, what I'm doing is teaching a skill set about how to communicate with children effectively. And if anyone's got anything, like say you're working with the kinds of kids that you're asking me about now, I would say if that's raised in the program, I'll talk about what some of the most appropriate ways of working with it are, because I know that there are people, it's not one of my specialisms. I have worked with people, but mostly adults, who have come to me for all sorts of things, and then it actually turns out, for example, Lebanese. There are a lot of Lebanese people living in the Middle East, and many of them coming for different things, like stress, anger management, premature ejaculation, you name it, have come in with a symptom set. And then when we actually get down to it, it's the fact that they lived in a traumatized, war-torn environment as they were growing up, and they had a tremendous lack of any feeling of safety. And so then a stress at work or a stress in current life actually triggers all that unresolved trauma from childhood. So yes, there are things that I can point you in the direction of, and certainly play therapy is something that's been used a lot. I know someone who was volunteering in Romania during the 90s, during the time when they were having the civil war in the former Yugoslavia and so on. And she saw this footage from orphanages in Romania, and she went to actually work there and set up a project. And they were doing a lot of what I would refer to as play therapy in that context. It was very tough because a lot of the kids from a very early age had not had any, I was talking about stimulation, activity, building neural pathways and so on. A lot of the kids have actually just been shut or even handcuffed or tied into cots and not interacted, etc. So it was a big deal. But as I said, she had some good results, some good successes. And actually another one, a graduate of mine, has been working with refugee children in Germany, and she's been getting good results too. She set up a charity for kids with catastrophic or terminal illnesses called, I think it's called Dreams, about raising funds for those kids to have an experience that was one of their dreams that they would like to have fulfilled. So there are people doing, doing very good work, and I can recommend them. Sorry, yeah. Someone said.
I was just going to ask. Sorry, I was just going to ask about the dreams. Can you put the information for me, please?
That would be one if you could send me an email or write to me to remind me, because I'd have to get her contact details out and send them to you.
Okay.
She's based in Bahrain, but she's done work as I said, in Europe and so on. And she was in touch with me quite recently about getting a referral for someone in Dubai. So yeah, if you send me a message, I'll send you her contact details. I'll just dig them out. Do I teach courses for life coaching as well? Actually, when we do our NLP courses, which we only recently we've been allowed to do them online, but it wasn't soon enough to really recruit to them. Phil leads on the NLP courses. I do a bit on them, and he mostly teaches the coaching element. So the NLP has its own coaching program within it, and I find it so much better than any other coaching program in terms of using NLP language, working with the unconscious mind, not just working with the 1 to 5% that's conscious. That's the only kind of coaching. It's coaching. It's 360 degrees. It's team coaching. It's all the sort of classic coaching models, the GROW model, but it's taught within the context of neurology, language, the NLP. So that's how we do teach it. We haven't got dates yet in the diary, but that's something that, again, if you want to write to me and tell me of your interest, when we do have something, I can let you know. Sometimes we do individual life coaching, but more often, as I said, we prefer to train people. And I'm really focused at the moment, apart from these short courses I'm doing from the end of this month through June, my focus is entirely now on our new diploma, the Integrative Psychotherapy and Counselling course, it's not a coaching qualification, but it looks at the difference between coaching and therapy, etc. Someone says, would love to do it. I can send you an email discussing. Yeah, that's fine. Yes, send me, if you're interested in coaching and NLP, definitely we'll keep you posted on what we're doing. Anyone else got anything? Because I think we're just over time by a few minutes. I'm not in a rush, but some people may need to leave. I think a few people have had to leave now already. Any pressing questions before we wrap up now? I think I've answered all the questions that were put in the box. Oh, hang on, someone's put something about children. Oh no, that was the sleeping children, so I couldn't put the audio on. That's all right. I thought it was a question about children and sleeping, but it's not. That's okay. Okay, so if nobody's got any other questions, you've got my contact details, as I said. If you need to send me anything individually or privately, that's fine. And I hope that I see some of you again, hopefully on one of the courses that I'm doing, or any of the webinars. You're very welcome to. And thank you for coming, giving me your time and attention. And those of you especially who arrived so early. Someone says, how's living in Morocco? Well, I think the answer to that is, like anything, it depends where you're living in Morocco. Where we're living is looking out over the ocean, the Atlantic, the nearest town's called Essaouira, and it's very laid back. The police wear their masks around their chins, and people, when they are wearing masks, pull them off to spit on the street. So it's not exactly like Dubai or some parts of the world are at the moment. It's very windy very often in the summer especially. It's why it's famous for water sports, for kite surfing and windsurfing and so on. But the main thing for us is it's quiet, it's peaceful, and we're allowed to just sort of get on with living our lives. There's a farmer's market in one of the beach restaurants every Saturday. There's organic farms and permaculture. We're finding out more about the area than we have in the 16 years that we've it's 17 years actually now. We've had first some land, and then we built a house and a couple of smaller houses for people to stay and staff and so on. But we always spent sort of periods of time that weren't that long until the last couple of years, where it's been like a couple of months at a time. But this is the first time I've been here for so long, so it is very quiet and laid back. So I hope that's enough for you about living in Morocco. Very mild climate, not as warm as we hoped it might be in the winter, but it's not cold, you know. You just put on an extra jumper or have a fire or something. Okay, so again, thanks for attending and listening attentively, even if I didn't get to see all of you. And I hope you found it useful to you and some things to follow up there, whether or not you continue to study with me. So thanks, everybody, and hopefully be in touch again.